morning, everyone. I'm Ricardo with Congresswoman Ayanna Pressley's office. Thanks so much for joining us this morning for our press conference on the Treat Long COVID Act. Just a couple of quick housekeeping items before we get started. We will start the speaking program off with Congresswoman Pressley, followed by Congressman Beyer and our advocates. Once everyone has spoken, we will then take questions from members of the press on the line. To ask questions, please use the raise your hand function in Zoom after the representatives and guests provided their remarks. If anyone here, and I don't think we have anyone, but if anyone is dialed in to the meeting on their phones, we just ask that you use the Zoom link provided so that you can use the raise your hand feature to ask a question. And then finally, we just ask that members of the press keep their questions germane to the bill if possible. And with that, we will have Congresswoman Pressley get us started. Thank you.
Wonderful. Good morning, everyone. Thank you for joining us. I'm so appreciative of your joining us at this virtual table, and especially delighted to be here with my co-lead in the House, Representative Beyer, and our advocacy partners to discuss a critically important issue and the crisis within a crisis that has emerged during this pandemic, and that is long COVID. We are now over 2 years into this pandemic, and still the stories of COVID long haulers have been overlooked. Their pain and trauma have been neglected, and the burden that this illness has put on their lives and the lives of their loved ones has been shamefully ignored. Today, we declare loud and clear to the millions battling long COVID, we see you. You are not invisible. Your suffering is not imaginary, and it's time that your lived experiences are recognized and prioritized in the halls of power. Long COVID is a serious illness that is impacting millions across the country, people of all ages and all walks of life. And while there is no official count of people suffering from long COVID, conservative estimates show that nearly 8 million people may be impacted nationwide. That's at least 8 million people experiencing symptoms like fatigue and brain fog, to muscle pain and diarrhea, to difficulty breathing, heart palpitations, mini strokes. At least 8 million people who lack accessible and affordable medical treatment. But because there is no federal program focused on providing multidisciplinary treatment and care for folks with long COVID, for many of our long haulers, their physical and mental anguish has only worsened. Their employment and education, their lives have been disrupted and diminished. Our first of its kind bill, the Treat Long COVID Act, would address that head on by investing heavily in creating and expanding long COVID clinics across the country. As of in Massachusetts, which I represent, there are only a handful of long COVID clinics. And so our bill, the Long COVID Act, would dedicate resources at the Department of Health and Human Services to provide grants to expand long COVID clinics nationwide. These grants would empower healthcare providers to provide high quality, specialized treatment to patients right in their own communities. And funding would be prioritized for providers serving our most vulnerable and those disproportionately impacted by COVID-19, like our community health centers. These long COVID clinics would be staffed by folks of multiple disciplines and who understand the complexities of long COVID, and our bill would ensure this is key and something that I heard time and time again from long haulers, that no one is denied treatment based on insurance coverage, date, or method of diagnosis, or previous hospitalization. Our bill was designed in close partnership with patients and advocates from the long COVID community, many of whom join us today, because as we always said, the people closest to the pain should be the closest to the power, driving and informing the policy making. And momentum is on our side. Just this week, the Biden administration announced a whole of government effort to prevent, detect, and to treat long COVID. This is a sign that our efforts to raise awareness about long COVID are working. So as we look ahead to a just and equitable recovery from this pandemic, addressing the crisis of long COVID must remain front and center so we leave no one behind. Because a pandemic recovery that doesn't center our long haulers is not a recovery at all. And that's why we continue to call on Congress to pass another COVID relief package that includes meaningful funding to address the long COVID, and why Congressman Beyer and I are not letting up in our calls for the CDC to collect and publish robust, disaggregated demographic data on the prevalence of long COVID, so we can ensure resources are getting to those who are most impacted. So I'm grateful to everyone for joining us in this effort. Again, to our co-leads, Representatives Beyer, Blunt, Rochester, and Senator Duckworth, Kane, and Markey, and of course to our advocates for sharing their stories today. We must get our long haulers the resources and medical care they need, and that begins with passing the Treat Long COVID Act. With that, I will now turn it over to my co-lead, Representative Don Beyer.
Congresswoman Pressley, thank you very much, and thank you for including me in this really important bill. And thanks for bringing us all together today to discuss the critical importance of supporting Americans who are suffering from the long-term effects of COVID-19. I'm honored to be among these experts on long COVID, and I really admire this effort to create the funding necessary to help these Americans with treatment and care. You know, we've made so much progress in our fight against long COVID. I just got my second booster, my fourth shot about 20 minutes ago. And it's really exciting that we did it. So we have the masks, we have the testing, we have the vaccines, all the tools we need to protect ourselves from the virus. But there's a lot more to do. We're not at the end of this. And according to that recent GAO report that Congresswoman Pressley mentioned, long COVID may affect 7 to 8 million Americans, but 23 million Americans may actually be affected. We know 1 million have been affected enough to be stuck in bed in their homes, lost their jobs, can't work properly. The full magnitude of these health effects, economic effects, we don't know yet. It's expected to be significant. We don't want to repeat what happened with the various tick viruses and the like Lyme disease, where you go years with people think, well, this is in your head, or it may not be real, or how do you diagnose it? Because this is very real for the people that have it. I'm pleased that one of the co-sponsors of Congresswoman Pressley's bill, Senator Tim Kaine, who has himself been struggling with long COVID now for, I believe, 2 years this month, with no real sign of it abating. We've got to prioritize these up to 23 million Americans and help them get the treatment they need, help create communities of care, help fund those centers that, as Congresswoman Pressley is doing. You know, I was under the illusion too that this was mostly affecting people that got it before the vaccines. But I heard just the other day, the spouse of one of our colleagues, 2 shots plus the booster, got COVID from Omicron and has long COVID now. So none of us are immune. I've been thankful that the Biden administration stepped up the plan that Ayanna mentioned, and that specifically they made it an eligible condition under the Americans with Disabilities Act. And I want to make sure that our unemployment agencies in the 50 states plus the District of Columbia recognize it as a real case, a real reason to go on disability, and make sure the insurance companies recognize that this is very real and that they're willing to cover the various expenses that happen. And all these bills would complement these actions. So bottom line, there's a desperate need for efforts to detect, prevent, and treat long COVID, and really create a community of long COVID sufferers who can support each other and give us the data we need to move forward. So Ayanna, Congresswoman Pressley, thank you for creating this essential step in improving the quality of life for millions of Americans. I look forward to being part of the discussion today. And Congresswoman Pressley, I yield back to you.
Thank you, Don. Thank you for your friendship and your leadership and partnership in this endeavor. And now we will turn the virtual mic over to Mia. Mia Eves Rubley, who is the director of the Disability Justice Initiative at the Center for American Progress. I do want to just point out that at the outset of the pandemic, there were many leaders and advocates in the disability community who predicted that this would be a mass disabling event. And it does seem that that is coming to pass. And so we're grateful for your leadership, Mia, and appreciate you joining us today.
Thank you so much for having me on here. You know, long COVID has ravaged communities across the country, leaving many without resources and piling medical debt. Research currently indicates that between 20 to 40% of individuals who get COVID end up with long COVID symptoms. The Center for American Progress reviewed the Bureau of Labor Statistics data that shows that 1.2 million more people in 2021 alone had some type of disabling condition, more than any other year since they started measuring disability data. And that number is particularly disheartening, understanding that many of those individuals are likely due to long COVID. We believe most of that is due to long COVID. We at CAP have had numerous conversations with individuals with long COVID who talk about the struggles of dealing with medical conditions while also dealing with financial stress. And while this is nothing new, it is extremely, extremely concerning. Many talk about how medical providers have often been unhelpful and how they are often misbelieved. That is why I'm thrilled to be here today for the release of Congresswoman Pressley's bill, Treat Long COVID, which will provide support to communities, particularly underserved communities and populations disproportionately impacted by COVID. It also ensures that individuals aren't denied treatment based on insurance coverage, date or method of diagnosis, or previous hospitalization. This begins to address the massive needs of individuals with long COVID. Major, major thank you again, Congresswoman Pressley and all of those who have supported this effort.
Thank you, Mia. And next we'll hear from Netia McCray, a constituent of mine and a member of the COVID-19 Longhauler Advocacy Project.
Thank you, Representative, and thank you all for joining us today. Sometimes they come and go, these symptoms. So as mentioned, my name is Netia McCray. I'm the executive director of a STEM nonprofit called Vajika and a proud Roxbury resident. And I'm here today as an advocate for the C-19 Longhauler Advocacy Project. First, thank you for this act and listening to our voices crafting this piece of legislation. I have to say, for years, the voices of those suffering from post-infectious disease have been unheard by our representatives, and we've had to wage our battles to survive in silence. So I want to say thank you to start off. Second, I want to go back 2 years ago when I woke up and I felt extreme tightness in my chest and a migraine, which left me on a bathroom floor, short of breath, and the room spinning. When I reached out to my doctor, I was told, if you can talk, you're fine. In a few short months, I went from a healthy, independent woman to someone requiring a 24/7 caretaker who happened to be my mother, who's also suffering from post-infectious disease. The inability to do simple math, the confusion, the short-term memory loss, the seizures, down to the microclots that are responsible for my heart attack have become my long-term COVID-19 symptoms. For 18 months, I attempted to figure out what was happening to my body and what had robbed me of my dream career serving my community. An ER visit, 5 primary care visits, and 5 specialist visits later, all I received was a recommendation to take a Tylenol, an adult coloring book, and yoga. It took 18 months before I was able to access testing that proved my initial PCR was a false negative, likely due to timing, and to receive a post-acute COVID-19 diagnosis. My mild infection should have landed me in the hospital. It did not. Monday was my 2-year anniversary, much like Senator Kane, from suffering from COVID-19. 24 months later, I'm still encountering individuals and medical professionals who believe mild COVID cases do not lead to severe consequences, or if you didn't have a positive test, you didn't have COVID. And I'm proof that's not true. To quote once again the late Bell Hooks, sustained grief is particularly disturbing in a culture that offers a quick fix for any pain. The realization that there is no quick fix is why it took so long for us to arrive at this realization that there are long consequences to COVID. My medical treatment and loss of income thus far is well over $100,000, including about $3,000 a month in seizure medication. And that's with insurance. Why? because long COVID treatment that I am going through is not considered a COVID-19 treatment. This is inaccessible to the majority of Americans, let alone my community, who are largely insured due to limited income or loss of employment, and because we live in a healthcare desert. Even access to an appropriate clinic or a healthcare professional who is aware of post-infectious diseases like long COVID, ME, MCAS, let alone treatment options, is rare. Given the estimated 8 to 24 million Americans suffering with long COVID, forcing patients to treat serious physiological health issues with Tylenol, positive thinking, and yoga is no longer an option. That is why the Treat Long COVID Act is so critical at this point in time. We need the Treat Long COVID Act in order to provide and expand that multidisciplinary long COVID care to communities like mine, regardless of their location, the method of diagnosis, their insurance, or previous health conditions. As we urgently return to normal, it is my hope that the Treat Long COVID Act will help myself and millions of others return to our normal after shouldering the burden of this pandemic. So once again, I say thank you for pulling together all these resources to make this a reality.
Nisha, thank you so much. And I'm as deeply impacted by your words now as I was at our initial roundtable in January. Thank you for sharing your story, your pain. Thank you for your impassioned plea for urgency in this moment. And thank you for your partnership in the crafting of this legislation. And next we will hear from Shamir Smith, a long COVID patient education advocate for Black urban families.
Good morning, everyone. Thank you so much, first of all, Representative Pressley and Representative Beyer, for your consistency in getting the message out about long COVID. My name is Shamir Smith. I'm 39 years old, and I'm from Baltimore, Maryland. I am now a former teacher, but I'm going to spend a little time to spill a little tea, okay? Because it's been 2 years since I've had long COVID. Let's talk about 2 years later. On Monday, this past Monday, I received some CT scan results while I was sitting with my mother, helping her with her own health crisis. And the CT scan results showed that my lungs have mild scarring. That's 2 years later. With long COVID, I have mild scarring on my lungs. Now, for somebody, they may suspect, were you a former smoker, or were you in an environment where there was a lot of pollution that could have perhaps infiltrated your lungs? That was not the case. As I drove home that Monday, I cried. I cried on the phone with my best friend, and she said, well, what's the problem? I said, because number one, here's another thing I have to deal with, right? Scarred lungs that usually there's no cure or there's no healing from. And number two, I cried because that was my vindication. That was my evidence that what I've experienced over the last 2 years has dramatically and devastatingly changed my life. It's changed the trajectory of my life. Those CT scan results are what I will now wave as a banner as I talk to long-term disability carriers, the Social Security Administration, and even to doctors, as Nisha mentioned, who still don't believe that long COVID is real. I should not be crying 2 years later about a piece of paper as vindication. Somebody should have believed me, and somebody should have believed us 2 years ago. The other part of this tea is that because of a pharmacy mistake, last week, I was abruptly, without my consent or control, I had to abruptly withdraw from my antidepressant medication. Because of long COVID and the reports that are shown, long COVID causes brain inflammation. That brain inflammation can cause severe depression and suicidal thoughts. As I stood at the counter, rattling my body because I could not sit still, because being abruptly withdrawn from any medication like that is dire and is crucial. I had to explain to the pharmacist my situation. I had to say, I'm a long COVID patient with severe depression. Where is my medication? And the third thing is, the facts are that as I walk outside my door and I get messages on social media and I talk to people, there are still not enough Black people who know about long COVID. And the reason is because there is no true demographic data still 2 years later that indicates our suffering. How many of us, we can guesstimate these numbers all we want to, as we say in the teaching career, but there is no hard data. And when there's no hard data, how can we educate the underserved if there's nothing to prove? 2 years ago, I decided to speak out as an advocate because I was sick and tired of the media whitewashing the long COVID experience. Every channel I turned on as I was suffering through blindness in my left eye, migraines like Netia, an inability to get out of the bed, diarrhea, delirium. I kept saying white women, and I kept saying somebody has to account for the experiences of Black women and families. And so when I say that now, as my mission becomes clearer as an advocate, that I'm speaking for Black families, Black urban families, like families who live in Baltimore, Maryland, where unemployment is at an all-time high, as well as high school dropouts. I have to consider that when I speak about Black families, I'm speaking collectively about the women I know, the women I've gotten a chance to know for the last 2 years. And I'll share who they are with you. Kimmy, who's married with 4 beautiful children. Cynthia, who is raising a brilliant son. Brooke, who is married with 2 kids and was a former teacher just like me. Margot, Dr. Margot Gage, who is a professor at Lamar University. And Netia, brilliant, bright, beautiful. These women are now parts of my family, but these women also have lives that have been completely devastated by long COVID. Netia talked about losing income. And as we know, teachers don't get paid that much. But I missed my $65,000 salary, which now, because of Social Security, has been reduced to only $1,600 a month. In the next week or 2, I will have to move out of this apartment because now being on Section 8 means I have to find a place that accommodates me. My Black urban family is also those of us who do not have insurance, who do not have access, and who do not have all of the resources that are necessary, because that's just the way our country is set up. We've put a lot of our minority people, Black people, at a disadvantage. And so this act, I hope that we're not just using buzzwords like underserved, underprivileged, low income. I am hoping that this act truly will be the beginning, not just it'll be the beginning, but it won't be the last of those of us who care about what's happening to people with long COVID. Thank you so much.
Shamira, thank you. And as I said in my remarks, millions have had their lives devastated and their lives diminished. And you eloquently, but painfully make that case. And what a disservice that our babies are missing out on you and your tutelage and your wisdom. But we thank you for turning your pain into purpose and for your commitment to this movement. And you are why why we have introduced this Long COVID Act. We see you. Your pain is not imaginary. It is as real as you are, and you are deserving of real support, federal support. And that is why we've introduced this legislation. So I know that votes have been called or will be imminently. And so in the interest of time, we do want to make sure that we answer any questions that the press may have. So I'm going to turn the program over to my Director of Communications, Ricardo Sanchez.
Great, thanks, Congresswoman. Yeah, we have time for a couple of questions. So folks could just use the raise your hand function in Zoom and we will call on you. All right, Peter Sullivan, over to you.
Hey, it's Peter Sullivan with the Hill newspaper. I just wanted to ask the members of Congress, do you sort of have a sense for the path forward for this legislation? Are you trying to, attach it to the COVID funding bill maybe, or do you kind of have a sense of that?
Well, certainly, we're advocating for a long COVID response to be a part of any efforts that would come out of the House. But we're introducing this independent bill, again, to build upon the anemic infrastructure that is already out there with these long COVID clinics, but to expand those. And I think that momentum is on our side with the announcement that comes from the White House this week to expand long COVID treatment. That's very encouraging. And also, given who my co-leads and conspirators are in this effort, Representative Beyer and Congresswoman Blunt Rochester in her leadership role on E&C, and also that it is a bicameral bill and that we have the support of Senator Duckworth. But I think at the end of the day, the point here is that failure is not an option. If there are at least 8 million people we're talking about here, and the numbers will only continue to grow. So I do believe that our prospects are good, but also that we are going to exact every tool and lever available to us. And so this, as Representative Beyer said earlier, this is not the totality of our effort here. Just one piece of a broader piece of advocacy. Representative Beyer?
Just to quickly add, it would be perfect to put it on the COVID supplemental, but this is important enough to stand alone. And there's no reason it can't pass by itself.
Well said and succinctly so. Thank you.
Great, and Gabby Galvin at Morning Consult, over to you.
Hey there, thanks for doing the call and thanks all for sharing your experiences. I've got 2 questions for the members on the phone. You highlighted the lack of access to long COVID clinics and, talking with patients, certainly the case, waiting lists are months long. If this bill passes, how quickly would you expect these new clinics to be expanded or created? And then 2, I know the pair of you have pushed for more demographic breakdowns of who's affected by long COVID. Does this legislation tackle that? And if not, is there another kind of path that you're continuing to push for that? Thanks.
Well, you can't manage what you don't know. So here you are, getting a fuller picture of who's impacted by long COVID. Just a fuller narrative of who's impacted, but it's really anecdotal. We need the data. And so that's why since January, I've been calling on the CDC to collect and to publish robust disaggregated demographic data on the prevalence of long COVID so that we can better understand it and make sure that we're targeting resources to those who are most impacted. And so that, and now that's a tenet of this legislation of our Long COVID Act. So the data collection is key. And as for the timing and the pacing, how we've set this up is to empower, public health through HHS, local public health efforts, including community health centers, which have been critical in combating health disparities and beating back this pandemic, who serve the communities that have been most impacted, just as one example, and empowering them to determine how best to use these grants to meet people where they are, and also to train and to staff up with the multidisciplinary staff who are knowledgeable about long COVID.
I just want to thank Guyana for leading the charge to get the CDC to release this data. Listen to Shamir and her impact on Black families and Black women, Black moms in Baltimore. Realize that could be a specific crisis, but we just don't know where else to focus our resources without that CDC data. So I'm glad to co-sign any letter Congresswoman Pressley leads. And when it comes to quickly, hey, they figured out how to get what the structure of that virus was in about 2 weeks and had vaccines in under 2 months. We can do it fast if we want to. It's just a matter of attention. And so that's what we're trying to do, is make sure the attention is there.
Absolutely. And so what I would anticipate, to the representative's point there, is that within months, HHS would then set these guidelines and a process. The grants would then go out. So, I think, again, failure is not an option. And we also have to move with urgency here, because it is quite literally a matter of life and death.
All right.
By the way, as all our reporters know, anytime you observe something, report on it, you change it. And that's what we're trying to do here.
That's right. That's right. All right. Well, thank you all for joining us. I'm sorry, Ricardo, do we have time? I know we have votes underway here.
One question, last one from Amy Sokolow at the Herald.
Hi, thank you for taking my question. So it does seem like this legislation would be very much targeted toward care and acute care. Is there sort of any consideration for the broader research efforts that need to go into understanding long COVID as well? Or is that kind of outside of the domain of this legislation?
Honestly, I see this as working hand in glove with the effort that was just announced by the White House, which will work through our VA system and will be focused on research. But this is focused on expanding treatment options for folks with long COVID, because not only have their experiences been delegitimized or denied, or if they are seen as credible, they're being denied treatment because they can't produce proof of a COVID test, because perhaps they tested prematurely and didn't have the viral load, or they tested too late, but they are suffering nonetheless. And so for those that are living with cognitive impairments, brain fog, heart palpitations, trauma, physical anguish, we just have to meet their needs. And so these centers will help provide that high quality, specialized treatment to patients in their own communities. And so again, their symptoms and experiences are real as they are. They're deserving of a real response. They're deserving of a federal response. And we have to move with urgency. But again, all of these things we'll be pushing for. So another COVID package, fighting to see if long COVID can be a part of that. But if not, this is a standalone. And then again, with the White House's announcement, I think we're finally getting the attention that this crisis deserves. And it's devastating that the predictions made by the disability community that this would be a mass disabling event are coming to pass. So we're being told.
And there are companion legislation that Congresswoman Pressley and I are co-leading with Senator Kaine to look at NIH and the CDC, and specifically the CORI, which is the Patient-Centered Outcome Research Initiative, all of which can help create community among the long COVID sufferers also.
Well, thank you all so much for joining us today. And we're going to have to transition so that we can get to votes. And we'll be seeing everyone soon. Thank you so much again, Don. Thank you, Mia. Thank you, Nisha. Thank you, Shamir.
Thank you, everyone. Good luck. Please get healthy.
Help is on the way.